Chancellor Merkel, Commissioner Bachelet, former Secretary General Ban Ki-moon, Excellencies, distinguished guests, dear colleagues and friends. It's a pleasure to welcome you to this summit, which gets at the core of WHO's mission to use the best available evidence to improve and protect health. The caliber of speakers we have today highlights just how important an issue this is. Throughout her time as Chancellor, Dr. Merkel has built a powerful legacy for research and evidence-based policy in Germany. And Commissioner Bachelet has championed the human right to science, including the joint appeal for open science with WHO and others in the COVID-19 response. And former Secretary General Ban Ki-moon has been a strong advocate for evidence-based decision-making, including the establishment of the UN Science Advisory Board to provide the UN and member states with evidence-informed guidance. Thank you all for joining us today and for your support for the role of science in public policy. Science has always been at the heart of improvements in health, and it remains at the heart of everything WHO does. As part of the WHO transformation, we created a new science division in 2019 to improve the way we gather, analyze, and distill evidence into guidance for countries, and to support countries to translate evidence into better policies, better practices, and better and measurable health outcomes. Together with our regional offices, the Science Division also coordinates the work of the Evidence-Informed Policy Network, or EVIPNet, which was established 15 years ago to promote the systematic use of evidence in policymaking, and is active in more than 50 countries. There are many examples of its success. In Brazil, the national network of evidence centers has helped to bridge the country's vast distances to support the improvement of municipal primary care, the health of indigenous communities, and the COVID-19 response. In the Republic of Moldova, a local team supported by WHO developed an evidence brief on alcohol control to the Ministry of Health, which led to changes in legislation. In Uganda, health authorities with support from WHO pioneered an evidence-informed decision-making approach on drug-resistant malaria to update national treatment policy. The Science Division has also played a key role in the COVID-19 pandemic, supporting the Health Emergencies Program to produce and quality assure more than 1,600 guidance documents in the face of rapidly evolving evidence. In February 2020, just weeks after the first cases were reported, the Science Division and the Health Emergencies Program convened a global research and innovation forum, bringing together more than 500 scientists from 60 countries to identify key research priorities. That meeting laid the foundation for the development of tools that have helped to prevent, detect, and treat COVID-19. Through the Solidarity Trial, we also ran one of the largest and most diverse clinical trials to generate robust data on therapeutics. But the early months of the pandemic exposed uneven levels of research and advice in different countries. This demonstrated the need for countries to have robust systems to translate evidence into policy. And we have all seen how important it is to counter misinformation with high-quality evidence, presented clearly to decision makers and the public. This summit is therefore an opportunity to take stock of lessons learned during COVID-19, and in particular, the need for country-led knowledge translation efforts. Let me leave you with 3 priorities. First, we cannot wait for another crisis to put scientific advisory mechanisms into place. The pandemic has underscored that the time to prepare and to earn the trust of the public is before a crisis occurs, not during. Second, we need cross-sectoral collaboration between the public and private sectors and civil society to turn science into action to save lives and protect public health. Third, we need to build sustainable evidence to policy translation mechanisms in all countries to put global evidence into local context and counter public distrust with evidence-informed, actionable policy recommendations. Thank you all for your participation in this important summit and for your commitment to harnessing the power of science to support WHO's mission to promote health, keep the world safe, and serve the vulnerable. I thank you. And Chair, back to you.
Thank you very much, Dr. Tedros. It is important what you say, that knowing that all public health interventions are local in nature, all public health practitioners need to respond to the charge expressed by you, how to transfer the concepts generated during this important global meeting to local public health units in large and small cities around the world. In other words, how to translate global evidence into local action. That is extremely important for all public health practitioners to remember. Our first session at this Global Evidence to Policy Summit is about innovating the global evidence policy nexus for more equitable and sustainable global health. I'm delighted to welcome our high-level keynote speakers. Her Excellency Chancellor Angela Merkel, outgoing Chancellor of the Federal Republic of Germany, Dr. Michelle Bachelet, the current United Nations High Commissioner for Human Rights and former President and Minister of Health and Defense Minister of Chile, Dr. Ban Ki-moon, Chair of the Ban Ki-moon Foundation for a Better Future and co-chair of the Ban Ki-moon Center for Global Citizens and previously United Nations Secretary General, and Dr. Soumya Swaminathan, the WHO Chief Scientist who brings 30 years of experience in clinical care and research. I now give the floor to Chancellor Merkel, who has a strong reputation of supporting the science policy interface and who has shown admirable leadership, especially during the COVID-19 pandemic. I have a message. Chancellor Merkel, she will be speaking in German. So please, you have the icon in your Zoom platform for the translation. You can activate it now so you can listen to Dr. Merkel as she goes by now. The floor is yours, Chancellor Merkel.
Thank you, Director General, dear Tedros, dear Ms. Bachelet, dear Mr. Ban Ki-moon, dear Ms. Swaminathan, ladies and gentlemen. I would like to thank you, dear Tedros, for inviting me to speak at the WHO's Global Evidence to Policy Summit. When a disease develops into an epidemic and then into a pandemic, we have every reason to seek the advice and counsel of science. What kind of pathogen are we confronted with? What needs to be done at the local, national, global level in order to contain the infection spread? How can we make sure that we share the findings and evidence and the measures that have proven effective as quickly as possible? At the end of 2019 and the beginning of 2020, we knew but little about the SARS-CoV-2 virus. However, coronaviruses were not an unknown quantity. In Germany, research had been ongoing on this since 2006. And once again, we were reminded of how important it is that there is a network in the field of health research. I'm very grateful to all the expert teams at the global scale that have shared their knowledge with everyone in order to quickly decode the virus. As early as by mid-January 2020, we had the first PCR test providing us with diagnostics. And in less than a year's time, we were able to develop effective and safe vaccines. That was indeed a milestone in pandemic management. And as the German chancellor, of course, I am pleased to note that German experts also had a hand in this. However important it may be that scientists establish networks, they also need to have a good rapport with politicians. In any event, we need to ensure that we provide sufficient national and international research support. Progress with regard to research, especially in an area that affects our health, should and must be that important to us. Unfortunately, though, not every country is able to provide for the necessary research capacities to the desirable extent. And it is this that illustrates the global importance of the Global Initiative Act Accelerator and its vaccine pillar, COVAX. On the one hand, we have been able to provide financial support for research into vaccines, therapeutics, and diagnostics. And on the other hand, we have provided poorer countries with vaccines. The G20 countries also committed themselves to further improving global access to urgently needed vaccines, therapeutics, and diagnostics. In so doing, we are moving closer to the goal recommended by WHO, and that is to make sure that at minimum of 40% of all people in all our countries are being vaccinated by the end of 2021 and 70% by the mid of 2022. In the medium and long term, we also have to continue to work to ensure that vaccines are not only produced in industrialized countries, but also in other countries, for example, in African countries. Undoubtedly, we will be facing new health challenges time and again. Thus, even a modern health system like the German health system has to be continuously developed further. For example, during the pandemic, we quickly noticed how important it is to further improve our reporting system, to start with the GPs, the laboratories and the health offices, all the way down to the Robert Koch Institute, our central institute for health monitoring and disease prevention. Undoubtedly, digitization plays an important part if we are to get a comprehensive picture of the infection's spread and activity. The interlinking of information and as clear and complex an overview are of elementary importance if we are to optimize our methods to treat and prevent the disease and the virus. But it's also important for political decision making, and that is why it's always been important for me to consult and ask the advice of experts from the fields of infectiology, immunology, the health system, and also from the field of ethics. For if we are to successfully fight the pandemic, we have to act as a society, and we need to provide the adequate political framework. If we are to shed more light on present and future infections and diseases, if we are to find the right answers, we need to develop and set up suitable platforms that allow for an exchange between scientists and politicians, between scientists and scientists too, not only at the national level, but also at the international level. I also believe that we need to be better equipped when it comes to find out more about where the diseases and epidemics have originated. And thus I welcome the fact that in setting up SAGO, the WHO Scientific Advisory Group for the Origins of Novel Pathogens, we're setting up a new unit of researchers that will be cooperating over a longer period of time. It will be their task to brief WHO about the emergence of new or novel pathogens. This will be of assistance, helping politicians to get at an earlier stage information regarding potentially alarming pathogens and thus be in a position to respond more quickly. Information and advice and counsel rely on data from areas like the environment, fauna, geography, sociology, and last but not least, from the health sector. The interdisciplinary and international collection, monitoring, and analysis of these data is no easy task. The more pleased am I that with the WHO Hub for Pandemic and Epidemic Intelligence, we are about to set up a new space in Berlin where data to help prevent other and further pandemics and epidemics will be analyzed, in which we can also develop the required instruments and test them. AI in particular can help us detect new connections in sets of data thus allowing us to further research this area. The WHO hub in Berlin will use these possibilities and these means and share any findings and insights with all the member states. In so doing, we will be able to earlier and better detect health threats and provide a basis for policy making. Allow me to summarize finally what in my eyes is of fundamental importance. 3 points. First, we need to make sure that there is more cooperation and more networking in the field of science, in the field of politics, but also between scientists and politicians. Second, we need efficient and effective structures. In order to achieve this, we need to place the financing of the World Health Organization on a reliable foundation. After all, WHO, as the coordinating body in the global health architecture, plays a central part. In addition, the mandates of all organizations and actors in global health should be clearly aligned. And third, we need to make sure that we further strengthen trust, because trust is an indispensable precondition of excellent cooperation. Pandemics know no borders. Shared challenges like pandemics can, despite national efforts being undertaken, only be overcome if we act together and cooperate. Instead of acting alone, we stand much better chances to successfully stand up to the horrors of pandemics. The present pandemic, with its catastrophic health consequences and also its impact on our economies, should serve as a lesson to us. We should build networks, structures, and trust. In so doing, creating the preconditions for our and future generations to better and more speedily respond to such health threats. We would also be well advised to lay down specific measures for better prevention, early detection, and response in a pandemic treaty or a similar legal instrument, and to lay it down in a binding manner. I think you have more than enough to discuss today, and thus I wish you a fruitful exchange of views during this summit. Last but not least, I would like to thank you all from the depth of my heart for your commitment and your contributions. Thank you.
Thank you very much, Chancellor Merkel, for your inspiring words. Now it is my pleasure to introduce the next speaker, Dr. Michelle Bachelet. She was the first female president of Chile. During her 2 presidential tenures, she promoted the rights of all, but particularly those of the most vulnerable. Among her many achievements, education and tax reforms and the creation of the National Institute for Human Rights stand out. So do the establishment of the Ministry of Women and Gender Equality, the adoption of quotas to increase women's political participation, and the approval of Civil Union Act legislation, granting rights to same-sex couples and thus advancing the LGBT rights. Dr. Bachelet, please, the floor is yours.
Thank you, Dr. Huerta. Excellencies, colleagues, and friends. It has been almost 2 years since governments and leaders had to swiftly make difficult choices to face multiple overlapping issues. And we continue to do so, as COVID-19 and its economic impact, coupled with the climate crisis, still pose enormous life-threatening challenges. But we have learned a lot during this month that can help us together recover better into a more equitable, sustainable, and resilient world. 2 prerequisites must be the basis of any decisions that have to be made. First is sound scientific evidence. That is what we have. What have let us know how the virus spreads, what could fight it, and how we could keep ourselves and each other safe. Analyzing a variety of data helped to track and fight the pandemic, and demographics helped countries understand who among their populations was most at risk. And you may be surprised that the use of sound science is also a human rights obligation. Which brings me to the second point. Human rights must be at the heart of the pandemic response. This is not to complicate matters, nor they are empty words. Human rights make efforts more effective. They are also useful guardrails at time of competing demands that keep us focused on a people-centered response. You may be asking yourself, but what good would human rights do in the middle of a multiple crisis? And in my experience as a medical doctor, former public health official, but also former president, I will answer a lot. Human rights provide the framework which can guide us when making the most difficult decisions. During COVID-19, we have seen countries that have put significant efforts to place scientists and experts in their task forces to deal with the pandemic from the medical, socio-cultural, and human rights perspective. These countries have shown more resilience. Others, who were swayed by political argument and misinformation, suffered more fatalities. Since the beginning of the pandemic, my office has developed a series of guidance documents that provides advice to government on how COVID-19 response can and should be human rights-based in areas such as healthcare, housing, emergency measures, among others. The guidance includes an emphasis on the collection and availability of anonymized, disaggregated data related to the pandemic. And the reason is simple. Disaggregated data will help COVID-19 response better address specific impacts related to gender, age, disability, or ethnicity, among others. It will also help remove barriers, preempt potential discrimination, monitor the rollout of health services, including vaccines, and ensure equal access to treatment. We also understand that there are challenges in maximizing public resources to meet human rights obligations. Aligning policies with the best scientific evidence available helps a state to do so during times of economic difficulties. With that in mind, my office launched the Surge initiative in September 2019 with teams composed of macroeconomists and experts on sustainable development and human rights. Through our field presences, this initiative seeks to expand our support to countries on implementing economic, social, and cultural rights. It links human rights with economics to curb inequalities and contribute to the achievement of the 2030 Agenda and Sustainable Development Goals. And I'm happy to share a few examples with you. In Kenya, Moldova, Maldives, and West Africa, we supported countries in collecting and analyzing disaggregated quantitative and qualitative data to measure the fulfillment of retrogression in health and other economic and social rights. In Serbia, Paraguay, Peru, and Mexico, we work with stakeholders in assessing impacts of COVID-19 on different vulnerable segments of the population and in formulating recommendations that align economic and social policies with human rights. During technical discussions with international financial institutions, governments, and others in Lebanon, Zambia, and Ukraine, we assisted the development of recommendations on how governments can dedicate the maximum available resources to guarantee economic and social rights while recovering from debt and economic crisis. Dear colleagues, as I mentioned earlier, everybody has the right to share in scientific advancement and its benefits. The Universal Declaration of Human Rights makes it clear. The Committee on Economic, Social, and Cultural Rights, on its turn, has elaborated on the convergence of human rights and science in its General Comment 25. In other words, scientific evidence and the medical advances that can be derived from it must be universally accessible. But while access to misinformation is free and is easy and free, that is often not the case with scientific knowledge. The cost of this discrepancy to human rights and human lives are increasingly higher. Last year, my office made a joint appeal for open science together with CERN, with UNESCO, and WHO. We call on states, international bodies, science, and medical institutions and practitioners to engage in different forms of cooperation to ensure the broadest possible sharing of scientific knowledge and the broadest possible access to the benefits of scientific knowledge. I commend the governments that supported this direction, whether in the form of effective and inclusive forms of communication or the distribution of health-related information, goods and services, including COVID-19 vaccines. Indeed, the pace at which we gained scientific knowledge in the past 18 months has been extraordinary. Through science, billions of COVID-19 vaccines have been produced at a rate which have helped save millions of lives. However, there are still huge gaps and barriers in the production and distribution to ensure that priority populations in all countries have access to them. COVID-19 has been the latest reminder that in our interconnected world, no one will be safe until everyone is safe. That my enjoyment of the right of health in Geneva is connected to the enjoyment of the right to health of others in every country. But amid the highly uneven and unjust vaccine rollout, developed and developing countries are on divergent paths towards recovery. That could usher a rise in inequalities that will further push millions into poverty and hunger, and which could ferment into widespread dissatisfaction and greater conflict. So we must do everything we can to avoid this. I emphasize once again that COVID-19 vaccine must be treated as a global public good. Private profit should not be prioritized over public health. To ensure improved access both to vaccine and essential medicine, I welcome initiatives that examine how to separate research and development costs from the price of the final product. This could be done through the WHO COVID-19 Technology Access Pool, which enables developers of therapeutics, diagnostics, vaccine, and other health products to share their intellectual property, their data, and their knowledge. Another way to facilitate manufacturers to scale up their production and supply of vaccine and therefore help to end vaccine inequity would be by waivers to the trade-related aspect of international intellectual property rights known as TRIPS. In that regard, I'm glad to hear that the recent talks among member states at the World Trade Organization have advanced towards convergence on how to address TRIPS in COVID-19 response. I hope that these talks further progress during the upcoming WTO's 12th Ministerial Conference into a temporary TRIPS waiver or an agreement that applies intellectual property rights in a manner that upholds and strengthens human rights. That includes the right to food, to health, and science for all people, especially those left furthest behind. Dear friends, during the recent Human Rights Council panel on COVID and inequalities, I was heartened to hear concerted calls for concrete action that prioritizes people's right to health and right to life. As I have said before, we must learn the lesson taught by COVID-19. This is the only way to recover better. With human rights and scientific evidence, we can still win back the development gains that we have been recently lost. We can reverse the pandemic of inequalities that COVID-19 has exacerbated, and we can rise out of this crisis with an equitable, sustainable, and resilient world. I thank you for your attention.
Thank you very much, Dr. Michelle Bachelet. Now let's gonna hear from Dr. Ban Ki-moon. He served as the 8th Secretary General of the United Nations from 2007 to 2016. He led the efforts for the landmark Paris Climate Agreement, and under his leadership, the Sustainable Development Goals and the 2030 Agenda were created. Mr. Ban Ki-moon currently serves as the co-chair of the Ban Ki-moon Center for Global Citizens, which seeks to empower youth and women to become active global citizens in creating a sustainable future for all. He is on video. Go ahead.
Honorable Tedros Adhanom Ghebreyesus, Director General of WHO, Her Excellency Angela Merkel, Chancellor of the Federal Republic of Germany, Honorable Michelle Bachelet, UN High Commissioner for Human Rights, Excellencies, distinguished speakers, and ladies and gentlemen. Thank you all for the opportunity to speak and share my perspectives at this timely and vital WHO Global Evidence to Policy Summit. The pandemic has made clear that we are living in an interconnected world and that no country, regardless of its size, wealth, or technological sophistication, can tackle COVID-19 alone. Cooperation and solidarity, partnership, and global governance are needed in our fight against COVID-19. Failure to respond effectively in the initial stage in many countries amplified psychological panic and confusion and unnecessarily politicized the local and global response. This situation exacerbated social instability and resulted in the collapse of global partnership and systematic management of the pandemic. We need to take stock of lessons learned to ensure the next potential pandemic and crisis can be addressed effectively based on evidence-informed policymaking. Learning from the successes and failures of each other is fundamental to improving our future response to pandemic. Listening to scientists and experts and sharing experience and expertise can make effective policies and best practices to be disseminated globally. Assessment of experiences and responses to COVID-19 of countries with better performance can provide lessons and implications for other countries that are still struggling with the health, social, and economic crisis triggered by COVID-19. Working together requires fast and non-discriminatory sharing of knowledge and the readiness to learn from each other. This summit is a prime example of how the world should get together virtually to exchange valuable lessons and provide the basis for sharing evidence-based policymaking. The Republic of Korea has maintained a high level of transparency and openness in managing the pandemic and presented a unique example of applying advanced science and ICT in maximizing the efficiency of coping with the crisis. But in fact, such a decisive and prompt response was possible only because Korea experienced earlier pandemics such as SARS, bird flu, and MERS, even before it was struck by the COVID-19 pandemic. The main secret of the Korean model is that it did not waste the valuable lessons it has learned from the previous pandemics and applied evidence-informed policymaking in its response to COVID-19. I'm sure the Korean case can offer many lessons for evidence to policymaking practices.
Dr.
This is why Ban Ki-moon Foundation for a Better Future has worked together with the Asian Development Bank, ADB, and initiated the establishment of the BKM Sustainable Health Management Platform, a new global information and technology-based response platform. This platform allows trusted scientific information and policy options related to COVID-19 to be easily accessed by all countries and thereby help foster evidence-based decision-making. The establishment of a new global information and technology-based response platform allows vetted scientific information and sustainable policy options for dealing with COVID-19 to be rapidly accessible to all countries. For the evidence-informed policy decision-making, which is the core goal of the Global Evidence to Policy Summit, this platform accelerates the aggregation of professional information on COVID-19 and facilitates the dissemination of lessons learned from country experiences. The Platform for Sustainable Health Management Solutions will provide a robust response mechanism that offers professional, non-political, neutral, and practical solutions for health emergencies. Our hope is that the platform can elevate global partnership to address COVID-19 through its information sharing capacity and help strengthen health systems and global capacity to address COVID-19. The COVID-19 pandemic should also be a wake-up call for better collaboration to achieve the Sustainable Development Goals, SDGs in short. The SDG vision for the future is to ensure that nobody is left behind. The SDGs offer a roadmap to build back better and greener after the pandemic. Less inequalities, construct healthy societies, and enhance global resilience to climate and new pandemics. To meet the SDGs, global collaboration and the global aspiration for international and regional cooperation, innovation, and engagement by all stakeholders are essential. There is no country that is resourceful or powerful enough to achieve the SDGs single-handed. The pandemic has made clear that we are living in an interconnected world, and countries need to put their hands together to work in global solidarity. While the COVID-19 pandemic has caused untold devastation around the world, it also provides us with a generational opportunity to build back better. We must strengthen our health systems and reduce inequalities to be prepared for future pandemics and build a better future for all. Every country must recognize that the only way to achieve these objectives is through effective knowledge sharing, multilateralism, and regional cooperation. The international community must elevate its collective efforts to address this crisis and develop its information sharing capacities. Information and knowledge sharing are public goods. Ultimately, the lessons learned from the pandemic must reinvigorate the necessity of cooperation and solidarity based on multilateralism and guide us to a more inclusive, sustainable, and resilient future. I wish you all a successful and insightful summit. Thank you all for your attention and leadership.
Thank you very much, Mr. Ban Ki-moon. Now we are going to hear from Dr. Sumiya Swaminathan. She was appointed WHO's first chief scientist in March of 2019. She is a pediatrician from India and a globally recognized researcher on tuberculosis and HIV. She brings her 30 years of experience in clinical care and research, and she has worked throughout her career to translate research into impactful programs. Dr. Swaminathan was Secretary of the Government of India for Health Research and Director General of the Indian Council of Medical Research from 2015 to 2017. In that position, she focused on bringing science and evidence into health policy making. Dr. Swaminathan, the floor is yours.
Thank you very much, Elmer, Your Excellencies, Dr. Angela Merkel, Chancellor of the Federal Republic of Germany, Dr. Michelle Bachelet, UN High Commissioner for Human Rights, Mr. Ban Ki-moon, former Secretary General, and Dr. Tedros. First of all, I want to thank all of you for your generosity of your time and also for sharing your very valuable thoughts about this whole area and space of how to really bring data and evidence into policy making, something that the COVID pandemic has really highlighted and brought to the fore. But obviously, the implications of this are far beyond the pandemic. We've always needed data to guide our policy making and evidence-informed decision making. But I think the pandemic has just highlighted the absolute need, but also highlighted what the challenges are, the gaps are in every country. I think that there's been an opportunity to examine how decisions were made, where there were challenges and gaps. And of course, we have been challenged, Everybody has been challenged, criticized, but hopefully this provides an opportunity to do better in the future. On our side here at the WHO, as you know, the science division is fairly new. It was set up about 9 months before the pandemic hit us. And so right from the beginning, we started working very closely with our emergencies program led by Dr. Mike Ryan to really set up new processes and mechanisms for rapid data and evidence review so that the guidelines and the recommendations that were put out by WHO were based on the most recent available data from all parts of the world, were appropriately reviewed and synthesized, because not all information out there is the same. There are differences in quality that need to be taken into account. There are differences in study design and so on. So you need experts, you need methodologists who are able to synthesize that evidence and make it in a format that can be understood. We had to also set up expert advisory groups that are free of conflicts of interest, because again, when major decisions are being made, particularly on which drugs should be used for treatment or which vaccines meet the benchmarks and the standards, it's important that the groups that are making those recommendations are free of conflicts of interest. We also very quickly recognized that there were gaps in the research enterprise or ecosystem, that there were a lot of duplications, a lot of very small studies, clinical trials that were being done in many countries, but they were not providing the kind of evidence that you need. So clinical trials need to be of the right size, they need to ask the right question, they need to enroll the right number of participants, and then you need to analyze them properly. And this is why WHO set up through its R&D blueprint mechanism. This was something that came about after the Ebola outbreak of 2016, when there was a gap, clear need on the ground for research, and there wasn't a good mechanism to do research during emergencies. And so the R&D blueprint for epidemics was set up at that time within the emergencies program, but supported by other parts of WHO. And it has been very successful in developing research roadmaps, in laying out the knowledge gaps, in bringing people together, not just for Ebola, and then later on for other diseases like Nipah and Lassa fever and the set of priority pathogens. But they also had in there a pathogen called pathogen X, for which a roadmap was already available. So it was relatively easy to get into that, to convene experts, and to then start the process of actually undertaking the research, providing protocols, standard protocols that countries could use, and so on. We also decided, or we had to, put out evidence guidance even before the evidence is complete. And sometimes you need to update your guidance as you learn new things, because this is a new pathogen, a new organism, a new disease. And so we set up what's called the living guidelines approach, where there's constant updating of specific recommendations based on new evidence. The best example of this is the living guidelines for COVID therapeutics, where we started with drugs like hydroxychloroquine and very quickly were able to show that it had no impact, but then went on to looking at specific antivirals like remdesivir, the monoclonal antibodies, corticosteroids, and now most recently, we are now looking at the small molecules from Merck and Pfizer, the new antiviral pills, which could actually be very, very important in the future for managing people who get infected to prevent them from developing severe disease. So many systems in WHO were actually adapted and modified to meet the needs of an emergency and a pandemic, but they also brought out, for me, very importantly, the immense possibilities of doing things differently in the future. A disease like tuberculosis, which still kills 1.5 million people every year, there's no reason why we should not use these global convenings, the collaboration that we saw between scientists, governments, funders, private and public sector, to develop new treatments, new vaccines for drugs, for diseases like TB, but make them available. And I think Dr. Bachelet really put a lot of focus and highlighted the fact that during a pandemic, or even for other public health emergencies like tuberculosis, it is really important to think about saving lives before we start thinking about profits. And it's important that data and research that is generated using public funds, using taxpayer funds, should then be made available to the public at large as a global public good. And so I think that philosophy, that really needs to be taken on board by everyone, by countries everywhere. So while there are lessons that have been learned, we have an existing mechanism, which is the EBIPNet Secretariat, that's actually organized this, and I'm very, very heartened to see so many people connected to this. Clearly, there is a lot of interest in this topic, and the EBIPNet Secretariat in WHO has been very active for over a decade, trying to build institutional capacity within countries. And we know today that this is essential, that it has to be multidisciplinary. You need the social and behavioral sciences as much as you need the quantitative sciences. You need the ethicists, the bioethicists. You need the legal expertise. You sometimes need philosophers and jurists, and also the lay public, people who represent communities, civil society. Their voices are very, very important and are often overlooked when decision-making is being done. So rather than a top-down approach, it would be great to see a new way of decision-making at the country level, which really involves all stakeholders, discusses solutions, not just the problem, but the solutions, and finds a solution that probably is locally relevant, is contextual, is embraced by the community. And we've seen, again, if communities do not embrace the decisions, if they question the decisions of authorities, then it's very difficult, whether it's vaccine mandates or other kinds of public health measures that have been imposed. The communities really need to be engaged. So there is a lot of opportunity. This is a 3-day conference that's going to have many sessions, but the most critical element is really the regional days that will be held tomorrow. Every WHO region is going to convene discussions around some of these topics, and then we come back on the 3rd day to again convene at the global level to understand what lessons have been learned, and really how can we take this forward and implement them. So with that, I'm going to hand it back to the moderator with, again, many, many thanks to our very distinguished dignitaries who joined us this afternoon. And thank you to Dr. Bachelet, particularly, for staying on for this whole session. We really value your voice as a strong supporter of not only human rights, but also health as a human right. Thank you very much.
Thank you very much, Dr. Sumiya. Very inspiring words. I think these 4 speeches today, remind me my first day of class at the School of Public Health, when the teacher told us, if you have a problem in your community that you want to resolve, you need, on one hand, a good communicator, somebody who can inform the public and gain their trust. And in the other hand, you need a politician who can make the right changes. This is what it's all about this session, bringing the gap between science and policies. I just want to show you something to the audience. It's something that we call the journalism. It's art form by which a person, Alex, he is drawing the ideas of our panelists. If you can share his screen with us so you can have a look. Every speech has its own drawing, and you can visit them at the art gallery, where Alex Hughes from Journalism will display his live drawings from selected summit sessions during day 1, 2, and 3. And now we go to the next part of our session, which is a panel discussion with ministers of health on leveraging evidence for policy change and societal transformation. The panel will reflect on the role of evidence policy mechanisms during the COVID-19 pandemic. The distinguished speakers from 5 countries and 5 regions will explore which investments will be needed to strengthen the capacities and capabilities of national systems to improve policy making, both in routine processes and in future global crises. The panel will be moderated by Professor Ilona Hick-Bush, founding director and chair of the Global Health Center at the Graduate Institute of International and Development Studies in Geneva, Switzerland. Ilona has a long history of promoting the evidence to policy interface. Most recently, she has played a major role in establishing the new WHO Berlin Hub for Pandemic and Epidemic Intelligence. It is my great pleasure to hand over the word to you, Ilona.
Thank you very much, Elma. Thank you so much. And good morning, good afternoon, good evening to everybody. I hope you have all that have joined us been able to hear the distinguished speakers beforehand, because they have made so many important points also for this panel. Now, this panel will take up one that you also saw in those illustrations and pictures. We want to discuss solutions, not problems. And the distinguished group of health ministers that is here with me is going to share with us their experiences, solutions that they found, and solutions that they think still must be put in place, because we have had experiences on how to address them. Obviously, COVID-19 was a wake-up call, but as we've heard, the interface of science and policy applies to many areas of health, and therefore anything that COVID-19 now helps us put in place will be of great help to other health challenges, will be of great help for possibly future pandemics. But one of the things it's also shown us, and I hope our distinguished panelists are going to make reference to it, it has shown the inherently political character of health policy making and the unbelievably political debate we have had around evidence in many countries. It's no longer how it was perhaps 10 years ago, when evidence was accepted as evidence. The world is round, but now things are really and truly being challenged. So we have a fantastic group of ministers here with us, actually an interesting mix of people with a medical background and an economic background. And we have said so frequently that there must be more discussion between economics and health. And here we have it actually within the health sector. They come from all around the world. We have His Excellency Dr. Budi Sadikin, who is Minister of Health of Indonesia. We have His Excellency Dr. Ahmed Al-Saidi, who is the Minister of Health in Oman. We have His Excellency Dr. Janez Poklukar, who is the Minister of Health of Slovenia and also holds the presidency of the European Union at this stage. We have with us His Excellency Dr. Enrique París, the Minister of Health of Chile, and last but not least, His Excellency Kwaku Ayumang Manu, the Minister of Health of Ghana. We'd like to welcome all of them. There is something about this panel I must address. You will see it's an all-male ministerial panel with a female moderator, but I hope everyone who watches can rest assured that the overall conference, and you've seen that in the opening, has quite strong women around. And I'm very, very happy that these distinguished people have made the time to discuss with us here. So welcome, dear ministers. We've agreed we would go through a set of questions rather than have a presentation by each of the ministers. That makes it more lively, that makes it more interesting. And I'm happy to move forward now with a first question that I'd like to pose to His Excellency, the Minister of Health of Ghana, to share with us what are the examples from Ghana where evidence was used most strongly to inform the COVID-19 responses in your country? Please, Your Excellency.
Thank you, Ilona. Right from day one, when we got the first case of COVID, we started first with laboratory testing. That is what was informing us to know whether we have got a disease in people here. And then our contact tracing continued. In the process, over the last 4.5 years or so, we have done over 1.8 million tests using our laboratory systems in country. There was one research institution that did all of that for us. Our FDA, Food and Drugs Agency, supported us in trying to actually do evaluation of our testing centers. And lately, the antigen test devices that were introduced into the system. Initially, based on science, we decided not to rely on antigen testing. So science advised that we should use only PCR testing. And that is exactly what we did, based on research that we have done up to the inadequacy and inefficiency of the antigen test kits that we were receiving initially, until later Food and Drugs Agency tested some that were giving us 95 to 98% efficiency before we allowed antigen testing to be done in our country. We joined to do the third clinical trials for Pfizer as a vaccine that we are now using in our country. FDA, Food and Drugs Agency, was also using its research unit to do evaluation of our dossier of all the vaccines that were being introduced. And after the evaluation, will give us the authorization to try to source for these vaccines to also use for vaccinations. Apart from these, we have to do genome sequencing. When the very
I'm worried, have we lost the minister? I think so. Let's give it one more second if he comes back. Yeah, there he is. Please come back, Mr. Minister. We lost you for a minute. Please unmute yourself.
I'm sorry, technology. Okay, so we started looking at genome sequencing when we got the deadly variant to try to check whether we're getting it from the airport, and we're trying to actually respond to the fact that we wouldn't allow those variants to get into our system. But we didn't succeed in that. Science helped us a lot, but eventually we're tracking what type of variant we have in some regions of the country to inform our decision making. We did several epidemiological surveys and several other things that were done. We're using science and how do I call it? Research to inform our policy decision making. I think I'm done.
Thank you very much, Your Excellency. I'd like to turn to the Minister of Health of Chile, please, to also share with us his experiences of using science for the COVID-19 response. Dear participants, the Minister will speak in Spanish. You can, of course, use the interpretation function here in the system. Please, Mr. Minister.
Wow.
En primer lugar, muchas gracias por invitarnos a participar en esta cumbre. Quiero saludar obviamente a Elmer Huerta y también a Ilona, que es la moderadora de esta reunión con los ministros. Especialmente me permito esta licencia, quisiera enviar un saludo a la doctora Michelle Bachelet, que como yo fue ministra de Salud de Chile y además fue presidenta de Chile en 2 oportunidades. ¿Y por qué digo esto? Esto porque quiero decir claramente que en el tema de la salud pública tiene que haber una continuidad dentro de los países. No puede ser que sea solo la responsabilidad de un gobierno, sino que este es un tema de Estado que traspasa obviamente a muchos gobiernos. Cabe destacar en nuestro país que la visión, el esfuerzo y el liderazgo justamente del presidente de la República, en conjunto con la colaboración activa de los equipos de los ministerios de Salud, de Relaciones Exteriores, que tuvieron mucho trabajo, y de Ciencias e Innovación, además de la entrega heroica de los profesionales de salud la integración de la red nacional de laboratorios. Comenzamos con 2 laboratorios, llegamos a tener a más de 120 laboratorios, y la cooperación público-privada, fundamentalmente en la atención de pacientes, han marcado el curso y el manejo de la enfermedad en nuestro país. También hay que destacar la colaboración de las universidades y de los hospitales institucionales. Como ejemplo del uso de la evidencia a nivel gubernamental, quiero destacar nuestro plan paso a paso, step by step. Corresponde a una estrategia gradual para enfrentar la pandemia considerando la realidad local de la evolución de la enfermedad en las distintas zonas de Chile. Chile es un país largo y angosto, tiene muchas realidades geográficas, sociales, económicas. Este plan implica un activo monitoreo epidemiológico de la enfermedad a través de un sistema centralizado de todos los casos COVID de Chile, que llamamos EpiVigila, permitiendo diseñar las estrategias del paso a paso bajo el análisis de todos los datos en los diversos territorios del país. Además, hemos considerado las recomendaciones de expertos científicos del Ministerio de Salud, de nuestro Consejo Asesor Científico COVID, que creamos especialmente para esta pandemia, y obviamente de la asesoría experta de la Organización Mundial de la Salud. Dependiendo de la disponibilidad de evidencia científica y de la urgencia de la situación, hemos utilizado diferentes fuentes de información para tomar decisiones. Siempre hemos querido tomar decisiones basadas en la evidencia. Por ejemplo, equipos técnicos del Ministerio de Salud, basándose en la mejor evidencia disponible, han analizado medidas preventivas, como por ejemplo, lavado de manos, distanciamiento físico, ventilación de espacios cerrados, que en nuestro país ha sido muy importante, riesgo de contagio y sobre todo la comunicación de riesgo, que ha sido un pilar fundamental en el manejo de la pandemia. Como país, además, hemos contribuido en algunas publicaciones internacionales basadas justamente en nuestros sistemas de registro. Profesionales de nuestro ministerio, en forma inédita, por ejemplo, publicaron este año el paper Efectividad de la vacuna SARS-CoV inactivada en Chile, publicado en el New England Journal of Medicine. Otro ejemplo es el compromiso de Chile con la evidencia internacional y el desarrollo de ensayos clínicos locales para distintas vacunas, ensayos clínicos en fase 3, que han permitido aprobar diferentes vacunas, mediante convenios de colaboración entre laboratorios internacionales como Sinovac, Janssen, AstraZeneca, CanSino, y universidades chilenas como la Pontificia Universidad Católica de Chile, la Universidad de Chile y también una universidad de regiones del sur de Chile, la Universidad de la Frontera. Esto nos ha permitido evaluar la efectividad de las vacunas para aplicarlas y distribuirlas de la mejor manera en la sociedad chilena, respetando los riesgos y beneficios reportados en los distintos subgrupos etarios y con comorbilidades. Como decía la doctora Bachelet, para nosotros a nivel latinoamericano es muy importante hablar de solidaridad, de entrega, de participación, de que todos los países puedan tener acceso equitativo, justo, a tiempo para las vacunas. Por eso hemos también hecho un convenio para instalar una fábrica, una empresa que va a producir vacunas en Chile, y ojalá que podamos ayudar a todos nuestros hermanos de Latinoamérica. Muchas gracias.
Thank you very much, Dr. Paris, and thank you so much for also drawing attention to a regional and a global level, the solidarity in science, but also a solidarity in making accessible the products, if I can call it, of science throughout the world with others. Thank you so much for that. I'd like to call now on His Excellency Dr. Sadikin from Indonesia. He's now joined us and I'm delighted he's here. Dr. Sadikin, would you share with us some of the areas and points in time when evidence was absolutely critical for your COVID response in Indonesia, please? Welcome.
Thank you, Ilona. And a small corrections. I don't have a doctor degrees in front of me. I'm actually a nuclear physicist, 30 years in banking, and just 10 months in at become health ministers in Indonesia. So let me share with you. We have four key strategies in Indonesia to control the pandemic. The first one is on the health protocol strategies. Second, on the testing, tracing, or surveillance strategies. The third one is vaccination strategies. And the last one is therapeutic strategies. On health protocols, after the first wave in January, February, we learned that we can access Google and Facebook mobility data to monitor the movement of our people down to the city level. So then when the second wave hitting us badly on June and July this year, we use this daily mobility data to make sure that we can impose the right policy response, whether to tighten or loosen movement in any cities. So instead of giving 100% lockdown policy for every cities, we can analyze cities by cities and determine based on the mobility of the people, the policy response. The second example that we are using data to make a policy response is on the testing and tracing. After the first wave, we implement an online reporting system for 1,800 PCR labs across the islands and country that do around 250,000 testing every day. By looking and analyzing the positivity rate down at the city level, we can again preempt and issue a policies about distributions of medicine, doctors, including at that time the oxygen concentrator, because we identified that in certain cities the speed and the increase of positivity rate is very, very fast. Then we can anticipate how we can equip our hospital 2 weeks or 4 weeks after the waves start coming. Another example is on the therapeutic side. In around June, at the end of June, we realized there are a lot of fatality happen not in the ICUs, but it happens at the emergency rooms. And based on the data, we analyzed also that those people die at a very low oxygen saturations. So that means they came to the hospital late. So we use this data to quickly launch a new policy in telemedicine. So every time we found a positive confirmed case, instead of waiting for them to come to the hospital, we make a group of telemedicine startup to call them, give them consultation, and also free medicine delivered to their home and house. And also a small device that they can control their oxygen saturations. And with the routine, regular daily consultations, if their oxygen saturations is reached below 95%, then they will ask to go to the hospital. And the last one that we did is on the vaccination side, because now we are doing between 2 million to 2.4 million jabs every day. And we can see the speed of vaccination down to the city level. So we use this for our distribution policies, because Indonesia have around 514 cities spread over more than 10,000 islands. So what we do, distributions or logistics is difficult. So while we are monitoring the delivery of the vaccine, we are also monitoring the daily vaccination speed. So we can anticipate where and when the vaccine need to be sent to those particular cities. So those 4 examples in health protocols, in surveillance, in therapeutics and vaccination that we are using extensively data and informations to make sure that we can write a proper and good policy response. Thank you, Ilona.
Thank you, Mr. Minister. Truly fascinating and showing how the access to real-time data is really changing the approaches to public health, the approaches to informing people and ensuring that the health system can respond adequately. And I hope these solutions are being listened to by many of the countries who are finding it more difficult to approach such a data-rich environment and apply it in the ways that you have described. We're moving on to His Excellency, the Minister of Health of Oman, Dr. Al-Saidi. And I wanted to ask you, Your Excellency, which sources of evidence have been most useful to you in terms of the political decisions that needed to be taken? Because there's still a difference here, you know, which kind of evidence really speaks to political decision makers? What can we learn here, please?
Thank you very much, Ilona, and very nice to see you again, and I'm delighted to be amongst this distinguished delegates, panelists in this team. And just a remark about all the health of ministers this evening are male or men. I can assure you, and our Minister of Health in Oman, the ladies are highly represented, and they are the majority of our workforce. And one of my deputies is a lady doctor as well. So women are very much empowered in Oman, which is, I believe in it, and our Sultan, His Majesty, strongly believe in it as well. Our sources of information, of course, and evidence came from two, international and local. We started preparing for this pandemic early January 2020. We are very lucky and proud to have an excellent surveillance system in Oman, which is well known in the region. And the team there were and still working around the clock to gather local and international evidence. And what we always decided to do, and we've been doing, is the transparency in submitting our data internationally and also informing our public about the disease. The number of cases are daily reported, the number of admission in our ICUs, in our general wards. So the main source initially were WHO and other similar organizations, because the pandemic was for us new. As you know, our healthcare system in Oman is about 51 years old only, but still, the data collected helped us a lot in the Supreme Committee, which was formed by His Majesty the Sultan on 20th of March 2020. We were relying on the evidence that were gathered, and the accuracy of this evidence and timely manner were crucial for us to take decision when to do partial lockdown, complete lockdown, which part of the country. Oman is not as large as my friend from Indonesia. We are about 312,000 square kilometers only, and our major cities are limited, but we are linked through electronic medical record system, which we established toward the end of last century. And this is live information. I can access the information 24/7, and so are my other colleagues in healthcare system. What also happened during this pandemic, which is a very interesting experience for us in Oman, sharing the information with other government healthcare sector, but also the private sector, they were all linked to one database where the information were distributed, were analyzed, and decisions were made accordingly. In addition, of course, to what I mentioned previously, there are certain aspects of this pandemic which we don't have the local capacities as yet, or we have limited. For example, the vaccines. Accrediting vaccines in Oman, we have our local accrediting system, but we relied on WHO, CDC, FDA, and the European medical agencies as well, with our local expertise. In addition to the local data and information, our Gulf Cooperation Council, the Ministers of Health, we have an office, and the data were shared initially daily with some recommendation amongst the GCC countries, and now they are shared weekly. So the sources of information were international, Initially, that was the majority, but then later on, it became mainly local, and the decisions were made according to the spread of the pandemic in countries, even coming to Oman or leaving Oman. The decisions by the Supreme Committee were aided by the technical team, which are based at the Ministry of Health. Thank you.
Thank you very much, Your Excellency. And again, you know, this focus on it needs accuracy, timeliness, live information, and the need to go local, that one really can dig deep into the data and be able to respond where it is most necessary, very similar to what we heard from Indonesia. So I think a message and a pattern is clearly emerging. What kind of evidence, what kind of data is most important? I'd like to turn now to Slovenia and Dr. Poklukar, if he could respond, which sources of evidence have proven most useful, and if possibly, Dr. Poklukar, if you could also say a few words about the interface with the European Union, the sharing of information perhaps with other countries in the Union. Please, the word is yours.
Thank you, Ilona, for a question. The governments and their public health institutes used various reliable sources of evidence that were available internationally for the preparation of recommendations and measures to tackle the COVID-19 pandemic. The guidance, data and information provided by WHO, ECDC, CDC and other international organizations were considered most useful, reliable and relevant. Existing international professional networks in the area were also considered as an important source. The evidence one thinks of first when confronted with the pandemic is the one on public health measures, clinical management of COVID-19 patients, and as well as adaptation and arrangement in the health system. In dealing with acceptance of the public health measures and vaccination, we have realized that we need additional evidence from behavioral science. To better communicate these measures, we must understand individual population groups. Getting interventions in place, we encountered many difficulties to the culture, historical and political context within our societies. This slowed down the implementation of the measures. It is encouraging to know that WHO Euro has developed a special department to ensure better understanding of how people behave and make decisions. During the pandemic, it also became apparent that the legal framework regarding emergency response needs to be adapted. This is especially important because different measures interfere with daily life of our citizens. Some of the measures are easily perceived as violation of human rights. Scientific evidence in this regard would also be helpful. Syndemic is the term that we are using nowadays. It would be useful to have the evidence available on, for example, the impact of pandemic on mental health and other non-communicable diseases. The evidence on the social and economic impact of pandemic would also be important. Thank you very much, Ilona.
Thank you very much, and thank you, Dr. Poklukar, for highlighting some of those blank spots that we had early on in the pandemic and that we still need to fill, and where we need to integrate other types of knowledge, different disciplines. And as you said, you know, the mirror of the political decisions is the citizens' decisions, the people's decisions, and how these are driven respectively and accepted. And one of the issues that, of course, has come to the fore is the issue of trust, which will be discussed later in one of the sessions as well. So this call for truly interdisciplinary knowledge-based science and database is, I think, a really, really critical one, and also important, as you indicated, for WHO and other international organizations to take up systematically. Now, if we look at the evidence to policy interface, it would be interesting to hear from some of the ministers which specific institutions and which mechanisms that you individually, but also, of course, your ministry, your staff, have relied on to move forward, particularly in the COVID-19 pandemic. Could I turn to Dr. Paris to share with us some of the institutions and mechanisms? You had already mentioned many of the Chilean universities, for example, but you might wish to highlight a couple of others. Please, Minister. We do not hear
Por
anything
supuesto, Ilona, con mucho agrado, con mucho gusto. También quiero saludar a todos los colegas que están participando, los ministros que están participando. En mi gabinete hay muchísimas mujeres, de hecho la mayoría de mis asesoras son mujeres y las que me acompañan hoy día, las dos son mujeres. Por lo tanto, quiero también destacar la labor que hacen las mujeres en el Ministerio de Salud. Los esfuerzos que hemos establecido en el Ministerio para informar decisiones con evidencia, obviamente que han ido evolucionando con el tiempo, considerando que al inicio de la pandemia la información disponible era muy limitada, versus lo que disponemos actualmente, una cantidad de publicaciones gigantesca. En un primer momento, creamos el Consejo Asesor Científico COVID-19, que asesora al Ministro de Salud y al Ministerio, y donde tuvimos o tenemos todavía representantes de la academia, representantes políticos, representantes antiguos ministros de salud, representantes de las sociedades científicas, etc. Y creamos algo muy interesante que se llamó, o se llama, porque todavía funciona, la Mesa Social COVID-19. ¿En qué consiste esto? En que junto con el Ministerio del Interior y el Ministerio de Salud, nosotros acogimos y formamos una mesa donde están representados los alcaldes, es decir, las autoridades que son elegidas por las comunas, por la población, donde hay también exministros de salud, ex y rectores de varias universidades y también representantes de los gremios de la salud. Esta mesa social COVID-19 fijó temas muy interesantes para ser desarrollados por el Ministerio, como por ejemplo el tema de la salud mental, que todavía no lo hemos tocado aquí en este panel, pero que es un tema que ha golpeado enormemente, obviamente, a una gran cantidad de personas, no solamente en Chile, sino que también en el mundo. Y también contamos con la colaboración del Consejo Asesor en Vacunas e Inmunizaciones, que es el que guía al Ministerio con respecto a las políticas y a las decisiones que hay que tomar cuando uno escoge una vacuna, cómo la va a usar, cómo la va a administrar, con cuánto tiempo la primera y la segunda dosis, etc. Nosotros hemos puesto más de 203 vacunas por 100 habitantes, es decir, hemos puesto ya a más del 92% de nuestra población doble dosis y a más de 7 millones de habitantes hemos puesto ya la dosis de refuerzo. Yo sé que eso es discutible desde el punto de vista de la Organización Mundial de la Salud. Así como también hemos desarrollado un monitoreo epidemiológico constante de la situación en el país en base a las recomendaciones de la OMS. Estos elementos que tomamos en cuenta fueron las fuentes de información más importantes frente a la evidencia que había hasta ese momento. A medida que comenzaron a surgir nuevos desafíos y nuevos estudios y mejor evidencia, La principal entidad encargada de apoyar la toma de decisión a nivel de políticas y recomendaciones para la práctica clínica fue nuestro propio Departamento de Evaluación de Tecnologías Sanitarias y Salud Basada en Evidencia, conocida como ETESA, la Unidad de Políticas de Salud Informadas por Evidencia, que lidera la iniciativa EVIPNet Chile, se encargó de realizar inicialmente una síntesis exploratoria de la evidencia a nivel mundial y un mapa de evidencia vivo, entre comillas, en constante actualización en más de 15 tópicos, derivando en el desarrollo de múltiples síntesis específicas que son solicitadas por las autoridades y otros departamentos del Ministerio. Nosotros emitimos un comunicado diario, informes sobre la evolución de la pandemia, sobre la cantidad de vacunas que estamos colocando, sobre la cantidad de pacientes que están hospitalizados tanto en sala como en las unidades de pacientes críticos. Y esto transparentemente para toda la población. Y 2 veces a la semana emitimos un boletín de Epivigila donde están todos los datos epidemiológicos de la evolución de la pandemia. La unidad de evidencia clínica, junto a la de evaluaciones económicas, que también ha sido muy importante de ser tomado en cuenta, han desarrollado el guía GRADE de práctica clínica para el manejo de la infección por SARS-CoV-2, que incluye 26 recomendaciones. ¿Para qué? Prevención, tamizaje y manejo del COVID-19. Hemos realizado más de 24 millones de exámenes de PCR para nuestros habitantes y mantenemos esa estrategia mientras se mantenga presente el coronavirus en Chile. Muchas gracias.
Thank you very much, Dr. Paris. And we can see that a number of countries have set up very concrete new mechanisms or strengthened and adapted existing mechanisms. I think having a list like this after this conference would be incredibly helpful for countries to work through and to see which of them might be helpful for their own countries. Of course, scientific councils have gained quite new importance. Dr. Pokluka, I turn to you. I understand you have to leave a little bit earlier. And therefore, if you could share with us what specific institutions and mechanisms you have worked with, which were perhaps newly created, which you found most useful.
Thank you for the question. At the national level, public health institutes are certainly the key institutions providing health data and evidence to support decision-making. Pandemic has brought to our attention that this public health function would have to be strengthened in terms of human resource development and IT support. The pandemic has proven to be a window of opportunity to ensure the necessary investments. At the European level, for example, financial mechanisms were agreed to support the member states in this regard. Let me mention the REACT European Union financial mechanisms and the Recovery and Resilience Facility. We have also been confronted with the challenge of transforming available scientific data and evidence into timely advice and practice. Communication to different population groups has represented another significant challenge. In this regard, the experience from working together with the WHO EVIPNet network was very useful. Tools such as policy briefs and policy dialogues can best enable us to communicate science to policy decision makers. Slovenia has a partner in the EVIPNet for some years now. We started with a situation analysis that facilitate evidence-informed policy making. Our memberships in EVIPNet Europe has been an opportunity to make connections to other countries, to learn from peers and engage in problem solving. Sharing knowledge and exchanging experiences with other countries proved vital in the COVID-19 pandemic. Pandemic has also transformed our perspective from European to global. The European Union is aiming to have a more strategic approach in dealing with global health. We see the WHO as the key organization to support its member states globally with data and evidence for decision-making. For Slovenia, the presidency of the Council of the European Union is an opportunity to further contribute to stronger collaboration at the global level with a special focus on strengthening health systems. We thus support the EVIPNet Global Initiative and call for action that will be discussed in this summit in the context of building resilient evidence to policy mechanisms. Thank you, Ilona.
Thank you very much, and thank you for sharing with us some of those dimensions of the European Union presidency and the interest that the presidency, also in particular the Slovenian presidency, is showing in global health and global cooperation. I think we will be seeing some results of that in the final council conclusions. So thank you very much for that. I'd like to stay with the global theme for a minute, and if I could turn to Minister Sadikin and ask him what you think are next steps that could be taken in order to strengthen research, policy, collaboration, and systems globally. Where would a global dimension support what you need to do at the national level? Please, Minister.
On the 1st December this year, we'll assume the G20 presidency. So it is important for us also to help setting up the global agenda, especially after this crisis. And I always recall because I've been in the finance industry for the last 30 years. If any countries everywhere in the world, if they have a fiscal or monetary problem, there is an established institution with a very strong funding, with a very straight protocols and very participatory, which is called IMF, that can come in and help very, very quickly. We need to have that in the health sector. So our theme for Indonesia G20 presidency, we need to upgrade the global health system architecture. Because of this pandemic, we have to admit that we need to improve the global health system architecture. And we would like to do it in 3 things. The first one, we need to build a global health system resilience. I give an example. We need to make sure that we establish enough global funding for this. And Indonesia, Italy, and WHO now is working to establish a global threat fund that will be filled between 10 to 15 billion per annum to make sure that for the next pandemic, we have this emergency fund to help. The second program that we would like to push forward in the building global health system resilience is not only the money. Indonesia has money, but we cannot access the ventilators. We cannot access masks. We cannot access vaccine. So we need also to establish access to a global emergency health resources. And we need to establish an optional contract underlying with this one. So if the next pandemic happens, all countries in the world can have the similar right to access to masks, to ventilators, to medicine, and also to vaccine. And the third initiative that we would like to do in building global health system resilience, we have to make sure that our network is working together. The genomic surveillance is not local. The virus spread all over the world very, very quickly. I remember when this happens, there is an institution, small institution called GIS-8, where all the scientists trust this institution and just submit the genomic sequence data to GIS-8. So we need to empower this institution. So for the next pandemic, all the scientists globally understand they need to submit the genome sequencing into this institution as part as our new global health system resilience. The second major program that we'd like to do initiative is standardizing the global health protocols. I'm amazed with somebody that invented passport, because I can use a single document, single requirement to enter every country. Now, if I want to go to Italy for G20 meeting, they have a standard, testing, PCR test, and then vaccine standard, quarantine standard. I go to China, different standard. I go to US, thanks God, I don't have to be quarantined. I can go just enter the United States. But different in standard of quarantine, different standard on vaccination, different standard on what are the documents needed for health protocols can be very confusing. So we globally need to agree on a global health standard protocols like the immigration agree on a passport. Third one, we need to make sure that we have to globally diversify the technology and also production capacity for key emergency medical resources, especially mRNA vaccine. It is very difficult for us, especially for countries, developing countries, to access to this vaccine unless we distribute the know-how and distribute the manufacturing hub to several other developing countries. And Indonesia is ready to be participate in this initiative. So those three things to establish a new global health system architecture, supporting by first initiative in global health system resilience, second initiative in global health standard protocol, and the third initiative in global diversifications of technology transfer, know-how, and also manufacturing hubs, I think is needed for us, not only to protect our generations, but also to protect our children, the children of our children, and the next generations of human beings. Thank you, Ilona.
Thank you, Minister. And there are indeed great expectations of the Indonesian G20 presidency, last not least because many of us were a bit disappointed this time around. And the move forward and also the indications of potentially working together with the G7, which Germany heads. We heard from Chancellor Merkel earlier on, of working with EU presidencies, of really, instead of going in parallel tracks, moving the global agenda forward jointly, and research evidence to policy need to be absolutely central to that, as you also indicated. And let's not forget the historical role Indonesia played, that we have a PIP framework, which people often forget, and which is an important part of our global instruments to deal with influenza, for example. I'd like to turn to His Excellency, the Minister of Health from Ghana. And maybe, Your Excellency, you can share with us some of the African initiatives that are coming together, that are also supporting Ghana, or where Ghana is playing a critical role in ensuring that African strength in science, in data collection, is enhanced to allow your responses to a pandemic situation, but also in building health systems throughout Africa. Please, Your Excellency.
Thank you very much, Ilona. Ilona, with the onslaught of COVID-19, Ghana, for example, we had actually set up research centers, and we use these research centers very, 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 very efficiently. We have our Food and Drugs Agency that has level 3 maturity accredited by WHO. We have One Shield Institute for Medical Research. We call it Doguchi Memorial Institute for Medical Research, which is next to Pasteur in Senegal. And they have been doing all the research on Ebola and whatever. So we had a situation actually on our hands that we could confront with. There is another collaborative center with a German scientist in one of our universities that was also there to help us do our tests and all that. Then we had West African Center for Cell Biology and Infectious Pathogens. So we're already there. And our Ghana Health Service had research centers so that we didn't have so much challenges with genome sequencing and all that. Then our public health institutions, and we have adopted to use the health information system that have been introduced by WHO in the past. All our districts supply information through this. So we have a centralized place where we process information on testing and epidemiology and all the other diseases and all that. Going forward, Ghana has actually started working to establish a vaccine institute for development of vaccine and manufacturing. And we are collaborating with other African countries to see how best we can get these things done. We will need support from outside to give us intellectual property rights to be able to produce vaccines in the region, not in only one country or two, maybe 3 or 4. Saying that when we are faced with pandemic and there's a blockade in India, like it happened in the previous past, we wouldn't have challenges in today's situation. And that is all we would need, plus other resources that can come very quickly without so much funds. Ghana apparently is also now working on establishing the Ghana CDC. We are also supporting the African CDC, that is the Nigeria now has got its own Nigeria CDC. So we are getting disease control centers across the globe, and we are all beaming into, how do I call it, the African one, saying that we can have responses in good time and plan towards that. AU has also mandated us, and we have ratified a situation where we're going to set up the African Medicines Agency that also collaborates various food and drugs agencies across the globe to look at what we can do together. But the most important thing is manufacturing of vaccines, not only that, our investments into medication and how we can also produce myriads of long lists of medicines on the continent through investments through the private sector. I believe that when we get these things set up properly in our system, that will be good for us. Our cold chain infrastructure seems to have been improved for Ghana in the event of COVID. When we started developing ultra-low temperature vaccines, apparently we didn't have much capacity, but with the support of the World Bank, we've managed to actually create capacity adequately enough in Ghana alone. I wouldn't know how much is there in the other African countries, but I think this is also an area where we need to find a way to expand and develop, to sit down, to expect, so that we can have any good response later in the future. I think these are the only big things that we may need to do now. But training of health care personnel on the continent is also a problem. Ghana, I don't think we are found short of some of these things, but other African countries may have challenges that I may not be able to actually evaluate at the moment. But these are areas where we have to look at. Thank you, Lona.
Thank you, Your Excellency. And of course, dear participants, you will have opportunity to further listen to other examples and discuss these matters in the regional sections of this conference. And I would like to encourage you very much to do so. Dr. Al-Saidi, can I ask you a question that has emerged from the questions and answers of participants? And they are asking to comment on how useful or problematic the news media were in advancing trust building and educating citizens and making them believe, if I can say, the evidence and the science that you are basing your decisions on. Would you like to comment on that, please?
Thank you very much, Ilona. Firstly, may I echo what our colleague from Indonesia said about money itself is not enough when it came to this pandemic. The shortage of PPE, ventilators, vaccines, medication in countries which don't produce these materials, unfortunately, was very obvious. So thank you for raising that point. In Oman, at least, we managed to get the media, at least the streamlined media and most of the social media, we managed to get them in our side for awareness program and for also highlighting the rumors, the misinformation that are spread by either whether locally or internationally, whether it is regarding the vaccine and the conspiracy theories, which and politicization of the virus or the vaccine and its efficacy and treatment. So they were partners from the beginning. Initially in the pandemic, we used to have almost weekly press conference, and we get all the media sectors, whether it's government, private, and international. And honestly, to be fair to them, at least in Oman, most of the time they were part of the solution, part of spreading the appropriate information, accurate information from the reliable sources. But we still face the misinformation, rumors, particularly when it came to the vaccine. We are very glad and lucky in this part of the world. The vaccine hesitancy is very, very low. The problem was not the vaccine hesitancy and refusal, it's getting the vaccines on the right time. But to be fair to the media, they were with us on almost every step. We made sure from the beginning that they will be part of the team, that they will be well informed and timely informed, as I've mentioned before. And I think we will continue that. And the transparency which we adopted regarding the cases, regarding the death rate, regarding the admission, the number of tests we do, the decisions of the Supreme Committee. I think this, luckily, we gained the trust of the media, and that, of course, led to the trust of, I would not say everybody in the country, but the trust of the majority in the country. So yes, I am delighted and glad that we're part of our team.
Thank you very much. Thank you very much to all the ministers who participated so actively in this discussion that raised so many issues and showed us so many solutions. We've clearly heard from them that countries did act, that new institutions and mechanisms were introduced that showed success. We saw that many of them are related to the new technology, to digital transformation, that real-time data play an absolutely critical role, that communicating with the population is absolutely essential, and therefore also a whole range of digital mechanisms can be helpful. And we heard, for example, from Indonesia that this is possible also in one of the most geographically dispersed nations that we have. I think we've also heard about a range of the challenges. Some of them will be taken up in the regional meetings tomorrow. But I would like to draw your attention again to the really important points that were raised in relation to the G20 presidency of Indonesia, which is why we were particularly happy that the minister was here with us to share that with us, because so many of these kind of agreements that he has indicated will be so important for implementation at the national level and will allow the sharing between data that are also collected globally, one of the issues that was raised, to then be applied at the regional and the national level. We've heard about science advisory councils, the cooperation with universities throughout the countries. We've heard about the need of new rules where international discrepancies emerge. One of the issues is, what kind of protocols will we all work to? Minister Poklukar has referred to how the European Union is partly trying to address this. So we have examples of solutions. So I really like this panel because it didn't only talk about problems, it showed solutions that were already implemented. It shows solutions that we know about, where we need to decide on implementing them. And it gave us some glimpses into the future, what else we need to take on as a challenge. And one of those, of course, is also what Dr. Al-Saidi spoke about. How do we deal with the digital transformation, the new media, the lack of trust in science and evidence in the general population? And that will be one of our key challenges, I believe, over the next years. Thank you very much to the ministers. I really enjoyed this panel. I learned so much. And thank you to the organizers. Goodbye.
Thank you very much, Ilona, for your stellar moderation of the panel discussion. And I completely agree with you. Your panel has been extraordinarily important. And I think the message is also that we are learning to build our response to the next pandemics. I think all these very important, positive interventions that we heard from the ministers of health and probably many others in the world, they need to serve us as a humanity to plan for the next pandemic and be ready. And of course, thank you very much for the honorable ministers for being part of our summit and for sharing your insights in how to leverage evidence for policy change and societal transformation. Well, I think we all deserve a little break now. We will reconvene at 4:15 p.m. Central European Time. In other words, in 15 minutes. But first, I have some little announcements. Participants can continue to post comments, questions using the comment function underneath the conference stream. The chat is moderated and we will be forwarding questions to speakers and the organizing team. Second, our meeting platform offers additional contents to discover. Participants are invited to explore the conference hall and the lobby during the breaks. Visit the illustrated art gallery, where Alex Hughes from Drawalism will display his live drawings from selected summit sessions during day 1, 2, and 3. Access the summit agenda to stay up to date on next sessions and upcoming events. And by visiting the 2 exhibition booths, there are more contents to be explored in this summit and the EVIP.net global websites. Visit the E2P public website and read an interview with the WHO Chief Scientist Soumya Swaminathan, or tune into podcasts with panel sessions moderators John Lavis and Ilona Kick-Bush. And finally, visit the global EVIP.net webpage to get to know the network and explore additional resources for evidence-informed decision-making. We will reconvene at 4:15 Central European Time in 15 minutes. Thank you very much. We'll be back.